Good day, this is the Professor, Professor CBMD PhD, and today's Monday, October 24th, 2022. It is 12:34 and 27 seconds, AM Eastern Standard Time, and today's research, history of breast cancer. So let's hop to it here. Earlier mammograms for women with family history of breast cancer may not be needed. Date October 21st. 2022. Source: University of California, Davis Hill. A new study may prompt medical experts to rethink when to start mammograms for women who have a mother, sister, or daughter diagnosed with breast cancer. Women with first-degree family relative diagnosed with breast cancer who are otherwise at average risk are often advised to get screened 10 years earlier than the relative's diagnosis age. However, there is little evidence to support the long-standing recommendation. More than 300 women were included in the national study. The researchers compared cumulative 5-year breast cancer incidence among women with and without first-degree family history of breast cancer by relative's age and diagnosis and screening age. The study concluded that a woman with a relative diagnosed at or before age 45 may wish to consider, in consultation with her doctor, initiating screening 5 to 8 years earlier than their relative's diagnosed age, rather than a decade earlier. That puts them at risk that is equal to that of an average risk woman who is age 50, which is the most recommended age for starting mammograms. BRCA gene mutation carries may benefit from starting screenings earlier. Women ages 30 to 39 with more than one first-degree relative diagnosed with breast cancer may wish to consider genetic counseling. Increasing the age for initiating screening could reduce the potential harms of starting breast cancer screenings too early, and these include increased radiation exposure and false positive results that require women to return to the clinic for diagnostic imaging and possibly invasive procedures, but do not result in a breast cancer diagnosis. The earlier a woman starts receiving mammograms, the more screenings they will undergo over their lifetime, and that increases the chances of experiencing these harms. Mammography also may not perform as well in younger women because they are more likely to have dense breasts, which increase the difficulty of finding cancer on the images and results in more false positives. Good day, this is the Professor, Professor of Microbiology, Bioinformatics, and Pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.